Tobacco use remains the single largest preventable cause of disease and premature death in the United States. Yet 42 million Americans still smoke cigarettes. To encourage smokers to kick the habit, each year the American Cancer Society marks the third Thursday of November for the Great American Smokeout. Smokers are urged to use the date to make a plan to quit. By quitting, even for one day, smokers will be taking an important step in avoiding asthma, lung cancer, and COPD. Ed Neuzil, a board-certified nurse practitioner with the Allergy, Sinus and Asthma Family Health Center, explains what COPD is and how it is treated.
COPD is actually a chronic obstructive pulmonary disease. So this is something that goes over a period of time, and it can include things like asthma, chronic bronchitis, emphysema. So it's kind of a cover term we've always associated with men, so we didn't look at women quite as much as what we had before. COPD is one of those diseases you just can't look at somebody and say, okay, you have COPD. And so the testing in women to rule out COPD has become more prevalent. COPD can be a result of a chronic inflammatory condition. So people that have had asthma early that's untreated can end up with COPD and never smoked before. But we also have to understand that asthma causes irritation in the airway, and if we don't resolve the inflammation, then it begins to scar, and it's something they call airway remodeling. And it's where you start to change the inner lining of the bronchial tubes to where they form more of a scar. And as they become circumferential, which means they get around the entire diameter of the airway, scars have a tendency to constrict. So when we look at young people and we detect asthma, it's prudent to really look at the fact that if it's left untreated, we can be developing COPD at later age. When you're looking at young people, their airways are quite small, so it does not take a lot of inflammation in order to start wheezing and having airway problems. So as we get bigger, we go from a diameter in the airway maybe the size of a pencil to the size of a thumb. And so you can see that you can still have inflammation, but you're not going to be as symptomatic, and it's not going to be as dramatic as when you're small and you have that smaller airway. When we look at different problems like asthma, COPD, emphysema, a lot of what we do here is called spirometry testing. We actually measure your airway functions. And if appropriate, we'll actually give you a treatment of a short-acting bronchodilator and measure again. And by the difference in your airway functions, we can determine an appropriate medical protocol for you.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus and Asthma Family Health Center, please visit our specialist directory. Just click the Take Charge of COPD tab on our homepage, yourhometownhealth.com.